Hello.
Hi.
I hear you want to have pre and vitro screening for Huntington's disease. Is that correct?
Yeah, but I just want to check to see if my eggs have it. I don't want to know if I have it. But my brother and my grandfather had Huntington's disease.
All right. So what we're going to do is take your egg and test it for the allele that is present in Huntington's. Does anybody on your spouse's side have a history of Huntington's disease?
No, it's just my side of the family. How exactly are you going to test for Huntington's disease?
Well, we will take your eggs and test for chromosome 4 for a repetition of the CAG sequence. So in patients without Huntington's disease, it only repeats about 28 times, but people with Huntington's, it repeats over 40.
What are the chances of my eggs carrying Huntington's disease?
Well, since you have an affected grandparent, it's about 50-50.
How accurate are these tests?
Well, according to the Washington Education Department, about 100%. We don't want to make any guarantees, though, so you should prepare yourself for the worst and the best.
So if I decide to get this test done, how much is it going to cost?
Well, normally it's less than $1,000, and sometimes insurance will pay for it, but most people don't want to notify their insurance due to the fact that they could raise your payments because of the fact that you're testing for Huntington's.
So in the long run, do you think it's better to test now and know, or to wait and see?
Well, I believe in doing it before because in a lot of cases, if they had tested earlier on, then it would have saved them a lot of time and money, and it would have given them the opportunity to plan their lives accordingly. But on the other hand, some parents say that if they had known earlier, that they might have restricted their child's independence and participation in things such as sports and childlike play.
Well, I'm not sure now if I want to get tested.
Well, I'm going to show you a pedigree of inheritance based on the information you gave me. The shaded regions are family members that are or may be affected by Huntington's.
So this is my family tree of the disease.
You could say that.
Okay, I think that I've changed my mind. I don't want to go through my life constantly worrying about if my child's health and whether or not I'm going to allow him or her to do normal things that a child will do. Plus, there's a 50-50 chance that I'm willing to wait out and see.
Well, if you ever reconsider, please feel free to call me with any questions, concerns, and I wish the best for you and your growing family.
Thank you. Have a nice day.
You too. Good luck.